My name is Dr. Richard Pan. I'm a pediatrician and a father, as well as a state senator, and I've worked throughout my life to keep children and families safe and healthy. And I'm pleased to be joined here by so many parents and my colleagues as well. I want to just, first of all, recognize both Senators Hannah Beth Jackson and Lois Wolk, who are here, and also my colleague Senator Ben Allen, who will be speaking later, and Assemblymember Lorena Gonzalez, who will also be speaking later as well. And also, we will be having here speak, and I'll introduce them later, Leah Russin, Amy Alfieri, who are both parents, Carrie Asbury, who's a teacher, and Paula Weiss, who's a senior in our community. So again, I want to thank everyone for being here. We are here today because Senator Ben Allen and I are partnering on a very important topic: the safety of our children and community from serious preventable diseases. And we are authoring legislation that will abolish the personal belief exemption that currently allows children who have not received the required vaccinations needed to protect the public health to enroll into our schools. This legislation also empowers parents by requiring parents to be notified of the vaccination rates at their child's school, with the minimum rate necessary to protect their child from a disease outbreak. You know, as a pediatrician, I have personally witnessed children suffering lifelong injury or death from vaccine-preventable infection. This does not have to happen. 2 years ago, I authored AB 2109, a law that requires parents to receive counseling from a doctor or other healthcare professional about vaccines and the disease they prevent. This law was implemented this school year, and I'm pleased to learn that because of that law, we've had more families immunize their children. But as recent outbreaks have shown, it is not enough. There are still neighborhoods here in our state of California where vaccination rates are too low. And there are some schools with vaccination rates as low as 40% below safe levels. Because too many unvaccinated people were exposed, a measles outbreak that began in Disneyland last December was not contained, but is now spreading through unvaccinated person to other unvaccinated person, spreading across our state and our country. And not just to people who chose not to get vaccinated, but is reaching people who cannot be vaccinated. We are talking about babies who cannot get the measles vaccine until she is a year old. We're talking about the child with leukemia whose immune system is suppressed. We are talking about the employee who becomes exposed and takes the disease home to their family. Which makes it important that at least 93% of people are immunized in a neighborhood to prevent measles from spreading and reaching someone who would become ill. But in too many schools, not enough children are immunized to prevent an outbreak. Our current laws are not strong enough to protect them or us. Vaccines have often been a victim of their own success, as many of us have never experienced a vaccine-preventable infection or known of someone who's been affected by one. Yet many of us are exposed to misinformation on the media and the internet, and therefore become hesitant and fearful about getting our children vaccinated. As a pediatrician, I've been worried about this trend for a long time. And with each passing year, we add to the number of unvaccinated people in our neighborhoods who are now able to spread diseases to others. We should not wait for more children to sicken or die before we act. And that's why I'm grateful that more and more people are speaking up. Parents are letting us know that our current laws are insufficient and don't protect their kids. I'd like to thank the parents we have here today, as well as others in our coalition. And with that, I'm proud to introduce my partner in this effort, Senator Ben Allen. Senator Allen.
Thank you so much. Well, thank you, everyone, for being here. And a special thanks to the families and the moms who brought their beautiful babies here. A couple people drove all the way in from Palo Alto this morning to underscore how important this issue is to them. I also want to send a very big thanks out to Dr. Pan, who's played such an important leadership role in protecting the public's health over his many years in public service. I'm proud as a former school board member to be standing with him, a pediatrician who cares deeply about public health and the health of our most vulnerable, our little ones, in this effort to try to protect our kids in schools. I come to this issue as a school board member, as someone who served on the board of the Santa Monica Malibu Unified School District's Board of Education before getting elected to the state Senate. And my interest in this issue comes out of the frustration of seeing very high very high non-vaccine rates in my district, and then basically being told that there was very little I could do as a school board member to protect my kids. I have just as Dr. Pan took the Hippocratic Oath to protect public health and protect his patients, I had a fiduciary duty to the students in my school district, and the current laws did not allow me to do what I felt might be necessary to protect the kids in my district. And that's what brings me to this issue today. We have rates in certain districts that are upwards of 15% of non-vaccination. This far exceeds the levels determined by the Centers for Disease Control necessary to protect public health, leaving so many of our children exposed to dangerous communicable diseases such as measles, whooping cough, and polio. In my own school district, the baseball coach has already been diagnosed with measles. We had to shut down an infant center in Santa Monica because of a measles outbreak. One of his local synagogues had recently had a major whooping cough outbreak. So these issues are impacting my constituents, and I'm just as upset as the baby is over here. So that's why we come to this issue here today. I know, by the way, that some folks from Univision and Telemundo are here, so let me say a couple words in español, solamente para decir que estamos acá para proteger la salud pública y especialmente los niños, los jóvenes. Cada padre que mande sus jóvenes, sus estudiantes a nuestras escuelas merecen saber de que vamos a tener un ambiente saludable en donde los estudiantes tienen la oportunidad de aprender y no enfermarse. Y por eso estamos acá tratando de hacer una llamada a todos los legisladores para unirse con nosotros para proteger a la salud pública y a los jóvenes que merecen un ambiente saludable y merecen evitar los efectos del sarampión y otras enfermedades. So we're here trying to send the message that parents deserve to know that their public officials are doing everything they can to protect their kids when they send them to school. That's why we're going and pushing to make this change. I appreciate all of this interest. We also very much appreciate all the parents who stepped forward in support of this effort. I think we're going to make a big difference here to help make sure that California joins the League of Civilized States when it comes to protection of our kids. So thank you so much for being here, and a very special thanks to Assemblymember Gonzalez and Senators Wolk and Jackson. Thank you. Thank you so much.
Thank you, Senator Allen. Our office has been receiving calls from people, parents across not only my district but the state saying that we need to do something. And I'm pleased to have here today Leah Russin, who actually called my office and has driven all the way from Palo Alto just to be here today to speak about her concerns about her child. So thank you.
Thank you to Dr. Richard Pan, Senator Ben Allen, Senator Wolk, Senator Jackson, and Assemblywoman Lorena Gonzalez for inviting me today. I'm honored to be here. Here in California, we're suffering from yet another epidemic of whooping cough, and now we have an outbreak of measles. Both diseases are highly infectious and can have serious complications like disability, sterility, and even death. The risk of my child getting sick is too big to dismiss. During my son's first year, I watched anxiously as pertussis spread through my community and worried about my son's potential exposure. We skipped playdates I thought too risky, avoided some museums and educational opportunities, and I held him close to me at the grocery store. I was so glad when he completed his Tdap series. As measles spread, I counted the days until he could get his MMR protection. Vaccinating him was hard. Who wants to make their child cry? But we do it. We do it because it protects our kids and it protects our community, and we count on other parents to do it too. Vaccinating our baby was the right thing to do for his health, for my family, and for my community. With the vaccines, he is stronger. He is less likely to get sick, and if he does, he's less likely to have terrible complications. He's less likely to infect another child. My son is now 16 months old, and he's up to date on his vaccines. But I still worry. My husband and I worry that our son will get sick if we put him in daycare. Many daycares in my area have vaccination rates well below what's necessary to protect the community, as do the public schools. We worry about whether to take him to play spaces and amusement parks with lots of other kids. We worry about taking him to our pediatrician's office if unvaccinated kids are present. There are so many things in life to worry about for my kid. We need to get rid of the personal belief exemption and get vaccination rates up so we don't have to spend time worrying about preventable infectious disease. I want my son to be healthy. I want him to grow strong. I want his friends to grow strong. I want to send him to school in a community that is healthy, and I am grateful that vaccines exist to protect him. I know this legislation will make him safer, make our schools safer, and make our communities safer. Thank you again.
Thank you. Thank you, Ms. Russin. Thank you so very much. Now, I also want to introduce Amy Alfieri, who's a parent actually in my own district, who also wishes to speak about her concerns as well. Amy.
Hi, my name is Amy Alfieri. I live in West Sacramento. I have a 3.5-year-old and an infant who is almost 12 months. She will be receiving her MMR very soon at her 12-month appointment. But since the measles outbreak, I, as the parent of a child who's under 12 months, I've been very concerned, as well as many moms in my social group and in my community. I believe that a lot of parents frame this issue as an issue of personal choice, and they under-vaccinate, avoid vaccinations, or selectively vaccinate their children, or create their own vaccination schedules that are, not in line with the current recommendations. It's not just an issue of personal choice. This is an issue that affects the whole community. We need to protect our children, you need to protect your own children, and protect children in the community at large. It's a public health issue. It affects everyone. There are many moms with newborn babies that are very concerned about pertussis, measles, H1N1, all kinds of diseases that we have vaccines for. I ask parents to listen to Dr. Richard Pan, to the American Academy of Pediatrics, to the Center for Disease Control, and to President Obama, who recently said that the evidence in favor of vaccination is indisputable. There's also a really good article on CNN.com today by Dr. Sanjay Gupta, where he says that the likelihood of being struck by lightning is greater than the likelihood of having a serious reaction to a vaccine. So I'm very much in favor of this legislation. Thank you.
Thank you. Thank you, Amy. Now I'd like to introduce Carrie Asbury, who's a teacher at Twin Rivers School District, and actually teaches many children who have special needs. Carrie.
Thank you. My name is Carrie Asbury. I am a special education teacher in the Twin Rivers Unified School District. In my 15 years as a teacher, I have worked with students who have had a variety of health needs: heart conditions, diabetes, leukemia, epilepsy, just to name a few. Unfortunately, I've also had to attend memorials for some of these students. One of the things that I did not have to worry about was diseases like polio or measles that just decades ago had impacted so many. The recent trend of not vaccinating students puts other students and school staff at risk, especially those with weakened immune systems, such as myself. Parents, teachers, and kids shouldn't be worried about contracting a life-threatening illness, especially diseases which are so easy to prevent, and just a decade ago were virtually eliminated in this country. An outbreak at a school site where crowded classrooms and cafeterias prevail could be devastating to a community and to the education system at that school site. That is why it's important that all students be vaccinated when entering the school system for the protection of the community, for the protection of the students, and the protection of the staff at that school site. Thank you, Dr. Pan and Senator Allen, for this important legislation.
Thank you so very much, Carrie. We also now have Paula Weiss, who's a senior in our community, who wants to talk about actually her own concerns. Thank you.
Well, I didn't hear any of the speeches when we put this together, but I want to thank all the mothers and fathers in this room. You have the hardest job on earth. I know a lot, but when I became a mother, I knew nothing. And it was my community that had to educate me. I'm Paula Weiss, and today I'm here because I am appalled and concerned by the number of unvaccinated people and the unnecessary spreading of preventable disease. I'm almost 72, and I'm old enough to remember what it was like before there were vaccinations for childhood diseases, including measles and polio. I am a retired teacher who remembers our school secretary checking enrollment forms and sending families home who did not have vaccinated children. I am also a grandmother of 2 vaccinated, adorable toddlers. I want all children protected. I remember what it used to be like. I recall being put in a bathtub to stop the itching and bring down my fever. I am very short, but I can remember the only shorter child in my class limped because of polio. I have a friend who had childhood polio, and he is in constant pain, he's my age, from the lingering effects of that virus. It stays in your body. The chickenpox virus stays in the body only to flare up as painful shingles. The chickenpox, adults, go get that shingle shot. You can avoid it. Before my grandchildren were born, I got a Tdap shot, so I would not bring whooping cough into their home. Today I heard of the death of an infant from a whooping cough. I get immunized not only to keep myself well, but also to protect those I love and those around me. Seniors may have compromised immune systems, but anyone can have a compromised immune system. Illnesses, medication, age, both young and old, threaten the well-being. Exposure to these preventable diseases carried by an unvaccinated person puts us all at risk. The measles epidemic now spreading throughout our nation illustrates just how dangerous the situation has become. As a retired teacher, a senior citizen, and a grandmother, and as a responsible person, I urge you to vaccinate yourself and your families. We have a dangerous situation in our country. I am so glad Senator Pan and Alan and all the rest of you who are here have stepped up to do something about it. Thank you.
Thank you.
So before the next speaker, I just want to also recognize that we have here today Dr. Dean Bloomberg from UC Davis, who's a pediatric infectious disease specialist and who may be able to help us answer some questions later on. So finally, we're going to have Assemblymember Lorena Gonzalez, who's a real champion for families and children, and who's an early co-author to this bill. And I'm proud to have worked with her in the Assembly and now to have her, again, be a strong partner on this bill. Assemblymember Gonzalez.
Thank you. Thank you, Dr. Pan. You know, as a mother, I know that the decisions that we make about our children's health care are deeply personal. And while I respect the fundamental right of families to make those health care decisions, when a parent's decision ignores science and medical fact and puts other children at risk, we can't as a state condone it. Unlike Senator Allen, I represent a highly immigrant portion of the state, South San Diego, and a vast majority of our schools are fully vaccinated. So when 13 cases of measles started spreading through San Diego County, we got desperate phone calls from parents. Not parents who don't want to vaccinate their children, parents who cannot vaccinate their children because they're too young or because they have a medical condition. And there was confusion within our immigrant community about why anyone would ever choose, if they could, to not vaccinate their children, and wanted to know if it was safe to bring their infants as they dropped off their kids at school. They asked me to do something about it, and I did what every parent should do when asked to deal with a medical issue. I called the doctor. And I said, Dr. Pan, can't we do something about this? You're the expert. Shouldn't we vaccinate everybody? And so I'm so excited and proud to sign on as the Assembly co-author and to wait patiently, I hope, for this bill to make it hopefully not too patiently, to make it to the assembly side so we can push it through there as well. We have our own expert in this legislature, somebody who, just like doctors who recommend vaccinations every single day, who has done that for his life, and I think is making a sound decision to suggest that school children in this state, if you want to send your kids to school, need to be vaccinated without a personal belief exemption. So thank you, Dr. Pan, thank you, Senator Allen, and I'm proud to join all these people as a co-author in this bill.
Thank you.
Thank you, Senator Gonzalez. So again, I want to thank everyone for being here. I want to thank all the parents here with their wonderful children. And I'd love to hear the sounds in the background. I think that's excellent. I want to thank again my colleagues for being here, and of course Senator Allen, who I'm partnering with. And so what I'd like to do now is open it up for questions.
Senator, the rules in the book, the laws on the books are there for a reason. And in the past, people felt that personal beliefs and how they treat their own bodies and their families is paramount. So what has changed now?
Well, I think what has always been there is the public health. And the reason the legislature has in the past passed laws requiring vaccinations for school entry. Keep in mind, that's what the past legislature has done. Passed laws to say that you are required to get vaccinated is to protect the public health. And what we're seeing now with the outbreaks is that we are in a situation where there are not enough people being vaccinated to contain these dangerous diseases. And what you're hearing from the parents here today, the ones here and the ones who've been calling my office and Senator Allen's office, my other colleagues' offices, is that they are scared. They are worried and they're scared that their children are going to now be impacted and infected with these diseases that are preventable. And it's not because they made a decision, it's because too many other people made the decision not to get their children vaccinated, and now we are having these outbreaks. We had a record number of cases of measles last year in 2014. I mean, we're talking about this Disneyland outbreak, but last year, in 2000, we declared measles eradicated from this country. Last year, we had over 644 cases of measles, and we're on a trajectory to pass that this year. That's a problem for the public health, and that's ultimately why we originally passed the law saying that you should get vaccinated before you enter school, and that's why we need to take further steps to be sure we can protect the public health.
But can't you argue that the people who are afraid of immunizations are parents too, and they're equally scared? And at what point does danger trump personal rights?
I would argue that when you look at the science and you look at the evidence, that the concerns that these parents have who are here, who have called my office, are based in science and fact. People are getting infected with measles right now. They're being hospitalized with measles right now because the immunization rates are low. It's not based on with a fallacious study, or it's based on reality, and that we have as elected officials and as to act to be sure we protect the public. That's really what this is about. We're trying to protect the public.
Senator Hahn, this is an issue that looks like it's going to put California in the same place as West Virginia and Mississippi. Those are the only two states, as I understand it, that do not allow any other exemption other than medical. How heavy a lift is this going to be politically for you to get this through the legislature?
Well, our goal is to ensure that we keep our immunization rates high enough to protect the public. And so that's what we're going to work toward. And I believe that's something that we can hopefully all agree on, that we should keep not only our children, but also everyone else. There's adults who are vulnerable too, keep them safe from these deadly diseases. And that's the goal of this legislation. Yes.
Does this include an exemption? Does your bill still recognize an exemption for religious beliefs? And if it does, then how are you going to determine whether the person is actually of whatever religion he or she is claiming?
So certainly, we can have a discussion about the nature of a religious exemption. At this point in time, our goal is to try to be sure that we get our immunization rates at the level it's necessary to protect the public. That's the goal of this bill. That's why we want to abolish the personal belief exemption. And so that's our goal as we're moving this bill through.
But what about a religious exemption?
we can certainly have a discussion about the nature of any sort of religious exemption that we may want to have. But our goal right now is to be sure we get our immunization rates up so we can protect all these children we have here in our communities.
Okay, but Dr. Pan, to be clear, the way that you've written the bill, it would continue to allow the religious exemption, but not the personal. Is that right?
So basically, yeah, we are abolishing the personal belief exemption here in the state. That's what the bill would do.
And that's different from the religious exemption?
So basically, we are abolishing the personal belief exemption in the bill. And that's what the bill does. We are going to be working to be sure that we have policies in place to get our immunization rates sufficiently high, and so we can have a discussion about what the nature of a religious exemption would be if that is the case for that we want to do that in the state of California.
Are those one and the same as personal belief and religious?
No, they are not the same.
Okay, so
right.
So you're only talking about personal belief.
Correct.
Okay.
Yes.
Dr. Penn, you talked about immunization rates and what the ideal rate would be in a community. I think you said it was laid out by the CDC, that number. Can you talk a little bit about what that ideal rate is to keep kids safe, and what is it in Sacramento County?
Sure. So the ideal rate, and again, it varies by vaccine, but let's take measles because that's what we're talking about. Measles is highly contagious. It's generally recommended that we have a rate at least 92%. Some people said 92, 94%, but at least 92%. We can't just look at the overall rate because in terms of across the state, the real issue is that we have pockets, areas, where those immunization rates are low, and therefore it will spread from there. So it's not just looking at what the statewide rate is. And that's why part of the bill is being sure that parents are informed of what the immunization rates are at the school that they're enrolling their children in, because you need to know what that rate is in that school. So if there's someone who shows up in that school with measles or some other vaccine preventable illness, you will know that if your child is potentially at risk because that will now spread throughout the school. There are not enough people who are immunized to help basically contain the disease. That's what we saw happen in Disneyland. There are not enough immunized people, that the number of unimmunized people is too great, that then it spread. And so what happens is, and then they went home and it spread and it spread. If you can get the rate high enough, generally you can contain the infection, and that's really the public health goal. So.
I have a question for you and a question for Senator Allen. Your bill that sort of helped reduce the rates by making it harder for people to get the personal exemption. As I recall, that was a pretty heavy lift. So what makes you think that this bill that goes even further, when you have basically factions on the left and the right who like this personal exemption, what makes you think politically that you can move this across the line?
I think the difference is that when I did AB 2109, at that point in time, the number of people who are unimmunized, because every year we add to that number, right? Every year you have a whole cohort number of people who come in, and then those kids get older and they don't get immunized, right? And so that number has been growing and growing and growing. And so when I did AB 2109, we were looking at how do we were noticing the curve in terms of the number of people. How can we try to bend that curve and reduce the number? But what we're also seeing today with the outbreaks that we see, whether we're talking about Disneyland and measles, pertussis, we had mumps outbreaks in colleges, so forth, that accumulation of people who are unvaccinated has grown so large that we're not able to contain these contagious diseases. That's why we hit a record 644 cases of measles in the country last year. We went from, you're in the teens, now you're at, and this year we're even going higher. So I think that has demonstrated, and so people are concerned, and rightfully so. Where before they sort of assumed, well, people decide not to get, but we are not seeing outbreaks, so my kid isn't going to get affected. But now what happens is that we have people, we have cases across the state and spreading across the country, and people starting to realize that I'm vulnerable. My children are vulnerable. It's not going to show up and then stop, right?
So you think the medical reality will make a political difference?
Well, I'll tell you that people, as a legislator, parents are calling my office saying, let's get kids vaccinated. Let's get them all vaccinated so we can protect each other. That is something that has definitely been much more, we've heard much more from parents who understand the importance of vaccines now standing up, standing with us, saying that this needs to get done. That it's no longer acceptable that I have to be afraid of going to the grocery store or going to the amusement park or having my kids go to school and worry that they're going to bring home an infectious disease.
Okay.
Right?
Well, and then a question for Senator Allen, if I may.
Okay, sure. Right here.
You represent an area where there are a lot of people who don't get immunized. So what are you hearing from your constituents? They're the ones who are filing these personal exemptions.
And as a result, it's my constituents who are most at risk. The vast majority of my constituents who actually do get immunized who are most at risk. So if anything, it's the majority of my constituents who have been coming to me asking for movement on this, because we do have too many people in our area who are choosing not to be immunized.
And don't you think they're going to oppose the bill?
Of course, but I think ultimately, look, there's a lot of different reasons why people don't get immunized, and I think as the one of the only good things coming out of this recent outbreak is I think it's raising public awareness of the need for vaccination, and it's reminding people. My father also suffered from polio. He was one of the very last people to get polio before the vaccine became readily, easily widespread accessible. And, he suffered through his entire life as a result. He's lived a wonderful life, but I'm sure, I know for a fact he would have very much wished that he could have gotten the opportunity to be vaccinated. We forget. We've protected ourselves so well that we forget the fact that this is a dangerous world. I mean, half of humanity was wiped out during the bubonic plague. And there's a reason why we don't have those kinds of risks anymore. It's because we've come together, we've researched, we've created vaccines and scientific solutions that help to protect humanity. And it's easy to get complacent, but take a quick look at history and you'll see how vulnerable we all are if we don't get smart about vaccinating ourselves. And so I think ultimately it's people in my district who are most at risk as a result of some of the misinformation that's out there. And we're gonna respect people, but we're also gonna respect the rights of those who, for whatever reason, may have a medical reason. Maybe the vaccine didn't kick in. Their rights need to be protected as well, and their health and safety needs to be protected as well.
A question for Dr.
Yes.
Pan. You talked about what you believe is misinformation and the problem with that. What do you think about national politicians coming out, someone like Senator Ron Paul saying that he knows about many cases of kids who have suffered mental disorders because of vaccination?
I hope that we can all talk honestly about the facts about vaccinations. There's a considerable amount of data about vaccinations. It's been studied by the Institute of Medicine, the safety of vaccinations. There have been numerous studies showing the safety and efficacy of vaccinations, and the fact that the side effects from vaccinations, and there are side effects, are orders of magnitude less than the actual disease, and that getting everyone vaccinated or getting to at least above the a threshold level helps protect everyone. And so I hope that the science hopefully should not become politicized. We should be talking about how do we protect the public. That's one of the most fundamental roles of government is public safety and protecting the public. And so this is really what this bill is about. This is what our work is here about. This is why everyone's here, because people want to be protected against these deadly diseases.
And then the legislation is for kids going to school, but would this apply for parents who choose to homeschool their kids, and if not, will this continue to be a problem at the grocery store or at Disney World?
So this bill, again, is based on removing the exemption for children who are being enrolled in schools and in child care for the current existing law, basically removing the exemption from the existing vaccine requirements that are necessary for entry.
It's public school, right, not private school?
Actually applies to both, because the laws pertaining to vaccination requirements apply to both public and private schools.
Including homeschooling? Is there a way to...
You know what?
Unless the homeschooling has a parent. Technically, some homeschooling people file as a private school, so therefore that.
if you file officially as a school, then you would be required because it's now registered as a school.
Is your bill going to be able to make a difference if people are still able to claim religious exemptions?
I think when you look at states that don't have a personal belief exemption, which, by the way, a majority of states do not. We are in the minority in having one. Majority of states do not. That you see that I believe their vaccination rates on overall, but we're worried about the pockets, but overall about 3 to 4% higher. So we believe this bill will make a difference in our vaccination rates.
Are you worried about anti-vaccine people really digging in when they're feeling like they're under assault, when politicians are introducing these bills to end the personal belief exemptions?
I can't speak to what they're planning to do. Even in communities where there are, quote, a large number of people who don't vaccinate their children, a vast majority actually do, right? Whether you're talking about Santa Monica or Marin or some other communities that have been cited, there may be enough to put people at risk because but yet the vast majority, usually 70-80%, still are vaccinating their children because they understand how important it is. And many of them are now standing up and saying, why should our children be put at risk, especially parents of children who cannot be protected, who be vaccinated themselves. You have families where they have a child who has cancer and may need chemotherapy and therefore they don't have the protection. They can't be protected with vaccination. We have babies here who are under a year of age who cannot get vaccinated against measles. They're too young. Those parents, they're worried about their children. Some of them are here. Many of them call my office. They're at home. They're talking. We need to listen to them as well. In fact, they are the majority. And so that's what this bill is about. It's about protecting public safety. Our goal is to try to get our immunization rates at a level that we can contain the disease, that it will not spread throughout our community. We do not need it to spread until it reaches someone who cannot protect themselves and cannot get vaccinated. We do not need to wait for a child to sicken or die before we act. And that's why we're doing this today.
Dr. Payne, if I could get back to this religious exemption, because I want to be clear. I'm looking at the language of the bill, there's a shall in there. I don't see any language. Are you saying that from the starting point, there's no exemption at all, but you're willing to consider trying to define a religious exemption? Is that essentially what you're saying?
I think it'd be good to have a discussion about the religious exemption and what the nature of that would be. The goal, again, is to get our immunization rates at a level high enough to protect the public.
But as a starting point today, that's not proposed.
We are just proposing to abolish the personal belief exemption.
Would it be retroactive? I mean, would people who have already elected or exempted their children, would they need to go get their kids immunized now, or would it start with a certain class of kindergartners?
Well, actually, by abolishing the personal belief exemption, a child who's attending school would need to meet the immunization requirements. So if they're still in school, they would need to. If you have someone who is now out of school, it's a little harder to track them down, and that would be different. But that actually is the concern that we've had over time, because it's, again, every year we've been adding more and more unvaccinated people to our communities because the school's usually where we catch them to check to see if they are. So, and that's what's happening over time.
How many confirmed measles cases are in California currently, and how many deaths have there been?
Okay.
There's 92 right now.
Okay. So I guess 92 in California. I think there was over 100 in the country, but we've been spreading out. We have fortunately not yet had any deaths from this particular outbreak. Just as a reminder, before the measles vaccine came into place in 1962, there were 400 to 500 deaths a year from measles. In 1991, in Philadelphia, there was a measles outbreak among unvaccinated children. I was actually there as a medical student. There were over 900. over 900 cases, and actually I think 6 children died of measles. They generally is estimated that for measles in, I guess, a developed country like ours, it's usually about 1 or 2 deaths per 1,000 infections. And there's not only death from measles, there's also encephalitis, so permanent brain damage as well. It's not a benign disease. And then actually, even of this outbreak, about a quarter of the people who've gotten measles have been hospitalized. So even in this particular outbreak, I certainly hope we don't need to wait for a child to die before people say, oh, now we need to do something.
But the flu kills more people every year. Why not require a flu shot before children go to school?
You know what? The flu is certainly, we encourage people to get vaccinated for the flu. For this particular bill, we're focusing on the immunizations that we as a society have already decided. We passed laws to say that these are required for school entry. So we are focusing on the fact that even for those that we're not reaching sufficient immunization rates, and we want to try to reach the rates necessary to protect the public from those diseases.
I think we're going to wrap it up, and if people want to get one-on-ones, we can go ahead and do that.
Okay, maybe I'll take the last one.
The Senate President Pro Tem and the Assembly Speaker support this bill?
I have not talked to them yet about the bill. I certainly hope they will, but I will let them speak for themselves when it comes to that. All right. Well, thank you so very much for being here. And again, I want to thank everyone and thank all our parents here and the children. Thank you very much.